Also, today we're going to talk about MCQs in surgery. So, this is the second part where we'll be talking about the MCQs in surgery. Okay, so let's go. So, for this part, we're going to go through about 30 MCQs. So, this is question 1. So, about nylon sutures. So, nylon suture is an absorbable suture, is a non-absorbable suture. C is naturally occurring, is easily digested by macrophages. So what is the answer to this question? So the correct answer is B, which is nylon suture is an unabsorbable, is a non-absorbable suture. Then question 2, the virus that has increased association with onwards: A. HPV, HIV, LMV, EBV. So which virus has increased association with onwards? So the correct answer here is A, which is the HPV virus. Then question 3, concerning fracture of the neck of femur. So they commonly occur in the teenagers. They are caused by high energy trauma in the elderly. Then skeletal traction is always recommended. Then avascular necrosis is a common complication. So which one is the answer? So the correct answer is D, which is avascular necrosis is a common complication. Okay, then question 4. Risk factors for developing an inguinal include all of the following except chronic cough, ascites, enlarged prostate, being alcoholic. So which one is not a risk factor for developing an inguinal? Correct answer is D, being alcoholic. It has nothing to do with someone having an hernia, but the other options A, B, C are risk factors. So question 5, this is which of the following is not a recognized complication of colostomy? So prolapse, necrosis, stenosis, constipation. So which one is not a complication of colostomy? So the correct answer is constipation. That's the correct answer. Okay. Question 6, which one below is not a type of colostomy? A. Spectacle colostomy, ileostomy, double barrel colostomy, loop colostomy. Then E, I've already shown you the answer. So but for this one it was easy, because they wanted which one not type of colostomy, and of course ileostomy was easy to pinpoint. Okay, so the answer is colostomy. The answer is ileostomy, sorry. So the answer is ileostomy. Okay. All are causes of dynamic intestinal obstruction except gallstones, burns, intussusception, and mesenteric vesicular occlusion. So remember, dynamic or all are causes of dynamic. So dynamic, some even cause mechanical causes. So which one is not a dynamic cause? So the answer is D, which is the mesenteric vesicular occlusion, which is on the dynamic part. Okay, question 8. Investigations of choice in peptic ulcer perforation is A. Ultrasound, which is USG, X-ray abdomen, paracentesis, CT scan. So which one is investigation of choice? So the correct answer is B, is the X-ray of the abdomen. Okay, question 9. The most common vessels to be affected in Buerger's disease: A. Femoral artery, iliac artery, popliteal artery, anterior and posterior tibial arteries. So which one is the most common vessels to be affected here? So we have anterior and posterior artery. That's the answer. Then question 10. Most common complication of fracture shaft of femur is malunion, non-union, knee stiffness, and fat embolism. So which one is the most common fracture here? Okay, so the answer here is C, your knee stiffness. And others most likely they like going with fat embolism, but fat embolism is a rare serious complication of shaft to femur, but it can occur. It doesn't mean it can't occur, but it can occur. Yeah, but as compared to knee stiffness is more common as compared to fat embolism. If you compare the two alone, the most important technical considerations at the time of below knee amputation is posterior flap should be longer than the anterior flap. Stump should be long, stump should be short, and the anterior flap should be longer than the posterior flap. So here, what's the answer? The answer is A. The posterior flap should be longer than the anterior flap. So remember your principles of amputation on your flaps, on your muscles, on your nerves, on your arteries. Remember the principles of amputation. Okay, and if you don't know, you can check out the principles of amputation. Okay, the most common carcinoma after burns is squamous cell carcinoma, adenocarcinoma, melanoma, and mucoid carcinoma. So the answer is A, which is squamous cell carcinoma. And question 13, the most common cause of death due to burns in early period is A, sepsis, B, hypothermic shock, C, both, D, none. So most common cause of death due to burns in early period is hypothermic shock. So that's the answer. And the most common question they like to asking you is if it's a theory setup, they can ask you, or a man setup, they can ask you how shock comes about in burns. Okay, strangulation most commonly occurs in A, femoral hernia, so it's supposed to be femoral hernia, direct inguinal hernia, indirect inguinal hernia, and lumbar hernia. So strangulation most commonly occurs in. The answer here is so A. So the answer here is supposed to be A. This is supposed to be A. So femoral hernia. That's the answer there. That's where strangulation most likely occurs in, as compared to what we have been given here. So A. Okay, so then question 15. Acute appendicitis is characterized by all of the following, except, okay, so anorexia, roving sign, fever more than 42 degrees Celsius, and periumbilical colic. Okay, so here the answer is C, a fever of more than 42 degrees Celsius. Okay, then question 16. Acute appendicitis is due to fecolith, worms of idiopsychogen, streptococcal infection, abuse of purgatives. Okay, so the answer is A, which is a fecolith. That's the most common cause of appendicitis, and it's the answer here. Okay, initial preferred investigation for thyroid nodule is FNAC, which is a fine nodule aspiration and cytology, radionuclide test, thyroid function tests, ultrasound. Okay, so investigation which is preferred is your fine needle aspiration for cytology. That's the which is the FNAC. Okay, then fracture femoral neck can be diagnosed from A, limb shortening, external rotation, abduction, A and B. So fracture femoral neck can be diagnosed from D, A and B, both limb shortening and external rotation. Okay, the thyroid carcinoma causes laryngeal paralysis due to a recurrent laryngeal nerve palsy, vagus nerve palsy, glossopharyngeal nerve palsy, hypoglossal nerve palsy. Okay, for the answer here is recurrent laryngeal nerve palsy. Okay, question 20. True about modified radical mastectomy is pectoralis major is removed, axillary lymph nodes are preserved, pectoralis minor is divided, then internal mammary lymph nodes are removed. So the correct answer is pectoralis minor is divided. That's the answer for this question. That's true about modified radical mastectomy. Then question 21. Complication of post-mastectomy lymphedema is metastasis of cancer, recurrency, lymphosarcoma, and pain. So the most complication of post-mastectomy lymphedema is answer is C, lymphosarcoma. Okay. Then distressing complication after modified radical mastectomy is lymphedema, axillary vein thrombosis, seroma, and death. So which one is a distressing complication? Okay, the answer is lymphedema. Lymphedema. Okay. Then the most common metastases in bone are derived from the most common metastases in bone are derived from a lung, breast, stomach, kidney. So where do the most and also prostate. So where do most common metastases in bone are derived from? So the answer is prostate. That's where most of these cancers that are found in bone are derived from. Okay. Then the following statement about bone sarcoma are true, except that it arises from the osteoblasts of the periosteum or bone cortex. B forms a fusiform mass encircling the bone, often invades the physiocartilage and neighboring joint, produces characteristic new bone formation in the X-ray. Okay, then E disseminates rapidly by the bloodstream. So here the answer is C, which is often invades the physiocartilage and the neighboring joint. Then the most vulnerable structure in supracondylar fracture of the humerus is the A median cubital vein, brachial artery, median nerve, ulnar nerve, and the radial nerve. So here the answer is C, the median nerve. And the most common affected nerve, if they were to ask the most common affected nerve, there is a branch of the median nerve called the interosseous nerve. That's the most common one which is affected, but it's just a branch of the median nerve. But if it was such a question and it's there, the interosseous nerve, that's the most commonly affected in supracondylar fractures. Question 26. In shoulder dislocations, humeral head usually dislocates primarily in which of the following directions? Inferiorly, superiorly, anteriorly, posteriorly, laterally. So where exactly does it dislocate, most commonly dislocate from? So the answer here is anteriorly. So anterior shoulder dislocation is the most common type of shoulder dislocation. 27. The most common injury following pelvic fracture is of bladder, urethra, rectum, vagina. So here the most common injury is bladder. That's where the pelvic fracture injures. Then 28. A Pott's fracture is a type of fracture of the wrist, ankle, spine, foot, skull. So the answer here is ankle, which is type B, option B. 29. A square strum is a piece of soft dead tissue, a piece of dead tissue, a dead tooth, a piece of dead bone. So a sequestrum is D, a piece of dead bone. So you have to know what a sequestrum is, what a cloaca is, and of course what an involucrum is, and their differences, be it in duration, be it in where they occur, and how to differentiate them. Okay. The deformity of wrist in Corey's fracture is Madelung's deformity, Dinafork deformity, Botania's deformity, none of the above. So the answer is B, the Dinafork deformity. And thank you for watching the surgery part 2 for MCQs. Thank you for watching once again. Please subscribe if you haven't subscribed, and recommend this video to people who are writing exams so they also benefit from it. See you next time.